Hello, everybody. My name is Professor Akosa, Executive Director of Healthy Ghana, a health-based NGO, and a former Director General of the Ghana Health Service. Ghana is in the throes of a cholera epidemic. Since 1971, when the first case of cholera was reported in Ghana, we seem to be having an annual epidemic of cholera. Today, we want to discuss how we can break the cycle of this annual cholera ritual. We're therefore going to discuss and dissect the whole issue of cholera, using it as an example of what we call the wider social determinants of health. How so many things that are not directly under the purview of the health sector impact so much on the health sector. And this is what we are going to have a conversation on. And I have with me in the studio for this conversation is Dr. Linda Vanotu, the Regional Director of Health Services, Greater Accra Region, and Dr. Simpson Boateng, the Public Health Physician of Accra Metropolitan Authority. We'll have a break and we'll be back. This is Akosa's Take. My name is Professor Akosa, Executive Director, Healthy Ghana, and the former Director General of the Ghana Health Service. Today, we're discussing breaking the cholera cycle. Dr. Linda Vanotu, let me start with you. What is cholera?
Thank you very much, Prof. Cholera is an acute diarrheal disease, which means that it is diarrhea that starts suddenly. It is quite profuse, and it is caused by a germ. And it is basically about somebody drinking water that is infected with fecal matter, that is feces, from someone who has the infection, or eating food that has fecal matter in it. So basically, it's about eating or drinking feces. And it is seen as profuse diarrhea. The person passes a lot of stools, bulky ones. That means that it's a lot at a time. Person might vomit and suddenly become dehydrated or lose so much fluid that it can even kill within a short time.
Well, from what you've said, it means that it is almost a personal thing, that you cannot inhale the organism or the germ that causes cholera. You have got to actively put that germ into your mouth, either from drinking water, infected water, or eating infected food. Now, drinking water. We know in Accra we have a problem, and Dr. Boateng, I'm coming to you. Most places in Accra don't have water. People have to go and fetch water. We know that one of the greatest problems we have is environmental sanitation and our ability to deal with our waste. How do we square this in a capital city that doesn't have water flowing through the pipes everywhere, that people have got to go and find water, and we are unable to also deal with the waste?
Yeah, thank you very much, Prof. I think you have hit the nail right on the top. You see, there are some areas in Accra which were not planned for human settlement. And naturally, those places were not taken into account when water infrastructure was being laid. the last epidemic we had before this one was traced, in fact, the first case was traced to a place called New Malta. And we trace it to a well. You know, people depend upon well water for their, you know, consumption. And that is where we had it, you see. So it is very true that such areas where water is a challenge is where the disease is mostly found. Now, you are talking about waste management. Yes. Waste management, that is, we have two types. That is liquid waste and solid waste. Dr. Linda Otu said that you can get the cholera when you have ingested or that when you have, you know, drunk or eaten food or water which is infected. Yes. We know the link between cholera and, you know, feces, that is toilets. We found out that in Accra, in fact, some 4 years ago, when we had a very major outbreak, we found out that most of the cases, in fact, the hardest hit area in Accra was at the about Soakan area. And when we conducted a survey there, our findings was that close to 90% of the houses there did not have toilets in them. You know, so we're not surprised, you know. So the problem is with waste management, that is liquid waste management. And because many people don't have toilets in their houses, this is what you have to expect. Now, if you come to solid waste management, you know, before there was no proper planned, you know, waste management system in place. People had to rely on the kaya bora, you know, these truck pushers, you know, and we didn't know where they were dumping the refuse, because they were not taking them to the final disposal site, you know. So they just push it when they get to a place, an open space, or into the drains, they just dump them there. And
okay, but I think let's go back. We now have an epidemic on our hands. We are unable to deal with the primary source, which is dealing with liquid waste. We allow people to live in houses that do not have toilets. But these houses have landlords. How on earth can Accra, or anywhere for that matter in this country, allow a home with a landlord that does not have toilet facilities? Where will the landlord expect the tenants to go and defecate?
Prof, you are very right. What is happening is that, in fact, before you are given permit to build here in Accra, you have to produce your drawings. And surprisingly, almost all the houses we went to originally had toilets in them, you know, especially the Bosokan area. The landlord had converted them into living rooms, offices, just to get extra money. You see, so it is not as if the assembly or the government is allowing that. It is the individuals. And I think they did it mostly out of ignorance, because they just don't know what the absence of a toilet in their homes can cause. You know.
One of the things that I learned when I was in medical school was Dr. Samarasinge, who occupied your position many years ago, telling us that public latrines are not extension of your homes. Somehow this kind of message has been truncated, and landlords have been allowed to do what they like. But if a landlord converts toilet, somehow the assembly must get to that landlord and either let the landlord reconvert or that landlord be seriously sanctioned. We don't seem to have done that, and probably that is one of the issues, but we'll come back to that. Let us just look at the current episode, or the current epidemic. If I ask you to give us an update, what is the total number and the distribution, and then we would take the issues further.
Thank you, Prof. Accra, unfortunately, has led in the epidemic as we are talking about now. Currently, we have over 12,000 cases. We have about 12,124 cases. And unfortunately for us, we have lost about 93 of them. And the hardest hit area is the Accra metropolis. All the sub-metros in the Accra metro have recorded the highest number of cases. They've reported about 50% of what we are talking about now. And except for Adan West, which has not reported a case from that district, every district in the Greater Accra region has recorded a case. Unfortunately for us, some of the cases have also come from the central region. For example, Kaswa is in central region, but they report here. And we've had a few cases that have come from other regions. But it's also important to note that some of the other regions that have recorded cases had the people coming from Accra. They traveled to Accra to transact business. And then when they went back, they reported with the diarrhea, which turned out to be cholera. So although we've received cases from other regions, we've also transported some to other regions. And I think that that is very, very key. Now, concerning what you were talking to Dr. Boateng about the public toilets and people not having toilets in their homes, we realize that in the areas that are hardest hit, some of them have some form of public toilet, privately owned, and the way they manage them. So you find that even the effluent, that's the water coming out where it's going to and all that, passes through the gutter. And we have instances where so-called pipes that are supposed to carry water have holes in them. And because they are also passing through the gutter, they can easily mix. Now, looking at the extent of the cases that we have now and the concentrations in various places, you find that there might be a link to what they are drinking. It's also of importance to note that the places that do not have water depend on water tankers. And some of them are makeshift tankers. They are not the very big ones. And they use this same tank to fetch water for people for other purposes, for example, building. And once they are going to use the water for building, they can fetch it from anywhere. When it comes to water for domestic use, they use the same kind of tank to fetch the water. We are not sure whether they clean them after they have fetched the water from anywhere for people to use. And we are sure that this is happening because in some of our districts where people have reported with the cholera, we realize that they were depending on services of these water tankers. And so we know that it is possible that this water that they drank had the fecal matter in them. Again, it's important to note that the cases that we have had, we've tried to find out where they were coming from, what was it. The first case that we had was a young girl, a 10-year-old girl who had trophy. And a lot of the cases have been linked to people who have bought food from outside and also from people who have bought this, what they call pure water. So even if the water that is in that so-called pure water is not contaminated, the handling of it, yes, of it could also be a challenge. So it's a whole lot of things that come together.
My deduction now is that personal hygiene probably is the key ingredient.
Yes. Yes.
But one of the things that you've just said also brings the point that if the water that you are going to drink is contaminated, then no matter how clean your hands are, the chances are that you can also get it. And that brings home a very significant issue, that this whole almost annual cycle can never be broken until and unless that constant education on personal hygiene, the treatment of water, because we have always said that water should either be boiled, filtered, so other mechanisms, so that before you drink water. But I think what is coming out is that even the water sachet, that one can be probably 50% certain that it is clean. If the handling is bad, those who drink it can have. We're on holidays. Schools are on holidays. But schools should be reopening very soon. Do you anticipate a surge in the numbers?
That's a big worry for us because some of these schools, in fact, a lot of them do not have toilets. And these are children. You know, we're talking about the primary school. Even adults that have heard that you have to wash your hands are getting cholera. So we are concerned about them. The second thing is that these children, when they go to school, you have people who sell around the school compound. They may prepare a drink or something, bring it in the morning, and keep it the whole day till the school closes. And therefore, these children, we don't know what they are going to drink for their water, the source and all that. We don't know. They don't have toilets in the school, so they may use anywhere for toilets, and they will buy the food. So we are really concerned. Even now that they are at home, Prof, we have children coming down with cholera. And it is very sad that we have even lost some. One would expect that a child under 10 years old would have the mother or the caregiver feeding this child and also teaching the child how to wash their hands and all that. So this personal hygiene that we are talking about is very important. And our hope is that when the schools reopen, immediately we will go there and then take them through that. But we also hope that as parents or as caregivers at home, they will teach their children. Even when they have come back from school or from town, wherever, they need to be taught how to wash their hands. And Prof, let me just add here that with the hand washing, we're talking about these chop bars and the rest. When you go there, you find that somebody buys food, fufu, banku, and they bring the person a small bowl of water with soap, and the person pours the soap on his or her hand and washes it. So whatever germs you have on your hand are still inside the water, and you are going to eat. So we are advocating people should have water in jugs or something. If you don't have the Veronica bucket, that's a bucket with the tap, so that you pour it onto the person's hand. And we want people to refuse, if they bring them this bowl, to wash their hands in them. They should have the water poured. You can use your hand to pour it onto the other one. And I think that that will be very helpful. So the schools reopening is a big worry for us.
Dr. Boateng, let's look at food vendoring. Ghana is probably the only country I know where anybody can set up, you know, a stall and cook and sell food without any authorization, without any certification, without any testing as to whether you are even a typhoid carrier, a hepatitis B carrier, all those things. And we know that wherever they sell, they do not have heaters, and therefore food is sold at room temperature. This is an AMA authority's business. What is it that AMA is doing, at least to ensure that people who have got to buy food from outside are not unduly risking their lives?
Thank you, Prof. The statistics we have is that the jurisdiction of AMA has over 35,000 food vendors in the city. And that is a huge number, you see. Now, it is not the policy of the AMA to allow people to vend or prepare food and sell when they have not been, you know, certified medically fit to do that. AMA is consistently arresting, especially those who don't undergo the screening. You know, we have set out courts dedicated to hearing only sanitation cases. We call them AMA sanitation courts. There are 3 of them now. And if you visit any of these courts, you will see that on a daily basis, we are prosecuting a number of people with sanitary offenses. Like when you mentioned the toilet issue, you see, it is not the policy of the AMA to allow, you know, to build public toilets. No, it is not. In fact, AMA is rather encouraging houses to have their own toilets. And because many people do not have toilets in their house, we have started prosecuting them. We have, on a daily basis, we have been prosecuting, and we have the records to show the number we have prosecuted so far since the inception of the course. So we are not allowing the people to do whatever they like. We may have a problem, and the problem is our numbers. You see, the environmental health officers, if you want to go by the WHO standards, in Accra for AIDS population, we should be expecting close to about 2,000 environmental health officers. But Prof, we have only 120 environmental health officers, and therefore they cannot be everywhere at the same time. Yes. So we are encouraging the public to also assist, and we are educating the people that if you see somebody selling food near gutters, you see, and there are a lot of them around, don't buy the food, because if you don't buy the food, you won't get sick, But if you patronize their food, and you are risking your life. So we keep on hammering home that people should avoid buying food from, vendors who prepare their food under unhygienic conditions. And we are also prosecuting them. We have them, and the records are there to show.
Mr. Barton, we'll take a commercial break, but we are looking to breaking the annual cholera cycle. Thank you. Welcome back to Professor Akosa's take. We're looking to breaking the annual cholera cycle. Just before we went on commercial break, we're dealing with the issue of food vendors. And for me, it is one of the critical issues that if anybody can cook and place the food anywhere and will get buyers, then we will continually have a problem. Now, the food vendor issue for me is one of the critical issues. Is it that AMA is, I suppose, overstretched with this matter, and therefore we want to appeal to Ghanaian citizens to say that if you go to buy food, you have got to find out whether the vendor is registered. And if the vendor is registered, then I think they must, have a registration badge that they put around their necks. And for me, what is even worrying is the mobile vendors. Somebody moves from Mamobi or Nima, and God knows how many kilometers that person will make throughout the day, selling to everybody, and it becomes virtually untraceable. So I will just come back again and say that how can we, and I think we're seeking ideas here, how can we deal with the food vendor issue?
Yeah, Prof, you see, what we are doing at AMA is that we have a task force in place, and the task force goes around seizing and destroying food being vended under unhygienic conditions, and we have evidence to show that. Recently, we went to Mensa Guinness. We destroyed all the food being cooked there, and that our activity was not limited to Mensa Guinness. We stretched it to the Circle, what we call Tema Station. We've gone to Choco. We are working on that. The task force is very active on that. So it is not as if we are just looking on. No, but we are also intensifying the education, asking people to ensure that they don't buy food from such people, because they will be buying nothing but poison.
Now we have on screen the spot map of suspected cholera cases. This is week 1 to 37. And the dark area is the metro, Accra Metro. And it looks like pretty much everybody in Accra Metro has it. We had that 12,100 cases.
12,124.
124 cases. And we all admitted that all these people have drunk an infected, water containing infected feces, or have eaten food containing infected feces. In other words, they have drunk or eaten somebody's toilet. This, for me, is a very serious issue. Now, as you did say, Adan West probably has no indigenous case, but everywhere else in Greater Accra has a case. Now, the area that borders Kaswa, because Kaswa is a very heavily populated area, yes, and I cannot imagine that every home in Kaswa has a toilet. So, you know, the proportion that could be coming from the adjoining Kaswa district is also very phenomenal. But let's go back and deal with this food vendoring situation. I thought I heard that the Ghana Health Service was being bold enough to make a very categorical statement about food vendoring. What was said behind closed doors, and what we heard, was it what Ghana Health Service, you know, wanted to do?
Well, I think it's all in support of people not buying food that will give them disease like cholera. So it was not like stop them completely, but just as Dr. Boateng said, it's very important that people understand why they must not do certain things. So what our Director General was saying, I don't think it's just stop them altogether. But we want people to not patronize food that will give them diseases. So we have to let the general public know what kind of food they eat that will bring them diseases. And then those who sell the food also know what they do that will affect the health of other people. The AMA has been going around destroying food and all that, but they are still there. Maybe they don't understand why they shouldn't be selling the food that is cold. So we need to continue with the education. I believe that that is what the Ghana Health Service was saying. Looking at 12,000 people just in one region, you cannot but ask that people don't sell food that way. So that is what it is. And Prof, adding to that, we also have the other people who sell like this ice cream and the rest, they move around. And you rightly said that they are selling things that could even bring hepatitis, which people probably have not thought about. Mm-hmm. And that is another disease altogether. So I think all in all, the food vendoring is very key. What I would suggest is that there should be a way of people identifying which of these food vendors have gone through a screening. So there should be a stamp or a certificate or something to put there. And this is where the AMA alone cannot do it. We may need the services of the Tourist Board, for example, or other agencies whose work will have an effect on this to be able to do this. And as we look at the food vendors, we should also be looking at the people who produce the sachet water. Mm-hmm. Some of them we hear do it at the backyard, and we don't know where they store the water before they fetch into these polythene bags and seal them. So it should go hand in hand. And this is where the wider stakeholder thing comes in. The ministries, Ministry of Water would come in, the Food and Drugs Authority, the Standards Authority, all these people would have to come in to ensure that any water that comes out is wholesome. And once we have this, even the young people who sell along the streets, I asked one young man, and we all buy phone cards from the street, I asked him, so when you come to the street, how often do you wash your head? Oh, madam, when we come, we never wash our hands till we have closed, and that is from morning till the night. So it's very, very, very important.
Now, we've just had the breakdown of suspected cholera cases for 2014. And as we did say, we have a total population in the Greater Accra region of 4.5 million, and we have to date 12,124, the largest number of almost 50% in the Accra Metro. Now, you know, beyond Accra Metro, we've got La Dade Kotopon, Tema Metro, and Ghana South as also the leading areas. I mean, these are very, very important, and our ability to deal with all the issues that we have presented today becomes very important. I still want to go back to food vendors. Can we not register them and expect that everybody will wear a badge so that if the unsuspecting Ghanaian public goes to buy food, at least they can identify that this is a certified food vendor? And also the fact that all of them must know that once the food temperature drops, it becomes almost a festering bowl of germs, so to speak. So is this something that we can expect to see of every food vendor registered and having an approved badge?
Yes, Prof. In fact, actually, what is happening is that every food vendor is expected to be registered and certified before vending the food. That is the standard. But unfortunately, because of their numbers, you see, and they are not static. I mean, they are moving from place to place all the time, and it is therefore very difficult to get them. But we screen them and issue them with certificates. So if you want to buy food, you can request or you can demand from the vendor.
No, we want something that they can wear around their neck.
Okay, it's
so
well
that
taken.
Becomes a point of identification.
Yes, I think we consider that. You see, the certificates we have designed are not the type you can put on this, and these were designed a long time ago. So I think we will need to modify it. Yes. We are going to, make it in such a way that it can be worn.
It can be worn around the neck. And even if you're mobile and you have it on, at least the general public can then identify you. Then it becomes easier for those who do not have the badges around their neck, to be spotted and picked up.
Yeah. But Prof, you see, there is a law against the hawking of any kind of thing in Accra. You see, so the food vendors hawking, this mobile, they are doing so illegally, and therefore they must not be, entertained at all. And AMA is not entertaining them at all. It is illegal to vend food. Because as she rightly said, then, where do they go to toilet? Where do they wash their hands when they go to toilet? And they are human beings, so they will necessarily have to go to toilet. You see, so we want to advise people that because we cannot eradicate, because we cannot get rid of all of them at the same time, just shun their food. Don't buy their food, and then you'll be okay. But if you continue buying food from them, then what do you expect? You see, so
we have another. This is deaths from cholera. In 2011 we had 72 deaths. In 2012 we had 48 deaths. Somehow we did something right in 2013.
Yeah, we had only 22 suspected cases
of
and
cholera.
no deaths. Yes.
Only 22.
Only 22.
And to date in 2014 we have 93 from 12,124. Now. 2013, how come? All the things that we're talking about, personal hygiene hadn't changed, the water people were drinking hadn't changed, food vending hadn't changed. How come that in 2013, for some reason, nobody had, or 22 people had it proven? Suspected,
yes.
But not
because
proven.
We didn't have any
deaths. So therefore, okay. But is it not curious that 1 year, we can just have 1 year like that?
It is, Prof. In 2011, we had about 9,000 cases. In 2012, there were close to 7,000 cases with deaths, as we saw. And we did a lot of public education, and I believe somehow the rains were also not so bad. And it's also been seen from the epidemic curve that previously it was about 5 years in between. Then it's now come to almost like a year. Yes, 2010, there were not so many. So 2011, 2012, 2 years running, and then 2013, we did not have. God willing, 2014, we'll see how it goes, and then we'll see whether the pattern has changed. But we started the education just as we did for 2013, and we sent all the messages around the radio stations as we did, and we did a lot of education with the AMA. We actually called a meeting with the Regional Coordinating Council and all the MMDAs, and we had this, we showed them what cholera is and how it comes about, how it is spread and all that, and what we could do to prevent that. Somehow, I'm not sure whether because we did not get cases in 2013, we relaxed a bit. I'm not sure about that, but it started in June, and it was like every week we were recording more than 300 cases with the rains almost every day. Prof, the other thing is that now we had 93 deaths. Unfortunately for us, this is the case fatality. That means out of the proportion that died. So this, it should always be less than 1. So it's 0.76, which is a little higher than the 0.7 of the number of cases and the number that died. A lot of these cases, unfortunately, were brought in dead. And that is another big source of worry for us. If you take the La area, for example, out of 14 cases that had died that time, 8 of them were brought in dead. And when you go further, you find that they were treating themselves somehow at home. And we realized that they used a certain kind of concoction to treat it at home. We are not sure whether it is because they don't know that this can kill within a short time or not. And we have had even people from all walks of life dying because they were kept at home and they were brought in dead. So we had to intensify our education on what to do at home and then run to the hospital immediately. That is a big worry for us, that about 1/3 of the deaths were actually brought in dead.
I just want us to put this in the context of wider social determinants of health. Do we know the educational background of, you know, the 12,124? How many of them just hadn't gone to school at all? How many of them finished primary school or did not finish? How many of them did JSS? Whether anybody who's done SSS and tertiary. You know, the understanding, and viewers, I want you to understand that education is a wider social determinant of health, because we know that people who've had, you know, education to beyond primary, the basic, receive health messages and act on health messages much better than those who've not been to school. So it is important that we disaggregate this kind of data to be able to find out the educational background of these kids. Are we doing anything like that?
That is true, that education would do that. But unfortunately, in this instance, we have had cases which you will not believe who have even died, though the education background was high. And it is all because of the way some of them were managed at home. One of them, for example, is somebody who should have been sent to the hospital by the parents, but they kept her at home for too long. And just when they got to the hospital, this person died. We have some who also were well educated, but ate wache and some other things. At this time, you wouldn't want to be eating wache and some salad that you are not sure of where the vegetables are coming from and all that. And unfortunately, that person also, who is very well educated, also passed away. So that is also a worry for us, that why is it that people are deciding to stay at home for too long and coming to the hospital dead when cholera can be treated? It's all about replacing the fluid and all that, but somehow some of them came late. We did a bit of analysis, and we did it more with the age groups and sex and all that. What we are now doing is analyzing the deaths. We are doing the death audits so that we'll know exactly why these people died, and then to address the gaps from our side as a health sector, and also be able to educate the public better in terms of what to do, especially because a lot of them were brought in dead. So that is, and when we did the analysis, we found that men were more attacked than women. Of course, one would say that they were eating more. We looked at the age groups, and most of them are between the ages of 20 to 49. But again, we had children. And then we have very old people, some of them over 70 years of age and all that. So now it's attacking all the age groups. Yes. Yeah. I remember when we were in medicals, we were told that very young children, under 2, if somebody under 2 has this. But we had a woman who was breastfeeding, who somehow had the feces on the hand, and the baby was infected. So even a baby, breastfeeding baby, also had it. So the whole situation is changing. And as you said about the social determinants, even the way we are now treating the children, that for me is a big worry, because if they're on vacation and we as parents are not able to feed them that they have to eat or drink food like this, then it is a source of worry.
Well, this is the year-on-year sort of a trend analysis, 2011, 2012, 2013, and 2014. And it's, virtually looking at suspected cases, number of deaths, case fatality rate, that is the number of deaths divided by the number of cases that we've had, and then the attack rate. And, we really can see that we are really having a serious bashing in 2014. Now, we've talked about food vending, we've talked about water, we've talked about provision of toilet facilities. The growing of vegetables in Accra and the type of water that is used to water these vegetables. I remember that way back 2005 when I was Director General, it became one of our major policy issues. Till today, you still have got vegetable growers who will block, a gutter and use water to water. And we still allow them, and freely, people come and buy. If you go to our neighboring countries, Francophone countries, you would realize that all of them have, let's say, a water source, a storage source, and they get water brought to them so that they can then water their vegetables. But we choose to use gutter water. Is that something that, obviously we're not doing something right?
Prof, we have pictures, to show where this is occurring. In fact, 37 military hospital, at one time they were discharging the medical waste untreated into the the drains, and along the drains there are a lot of these urban farms, and you see people fetching that water to water the listen, and it is very serious, very, very, very serious. But then, you see, it falls under the purview of the Minister of Agric, because they will tell you that a lot of livelihood depends upon these urban agric people, and therefore to deprive them of their destiny. But again, you must also know that their trade is causing deaths in the system. I think what should be done is to maybe encourage them to use good source of water. For instance, we can encourage them to dig wells, or they can come together and have pipe water. In fact, it is not every urban farmer who is doing what we are describing. There are some decent, urban farmers, especially around the Jowr area, and we have pictures to show all this. So it is in no small way contributing to the spread of the disease, yes.
But you see, this is where decentralization is so crucial. Because as soon as one says this falls under the purview of Ministry of Food and Agric, it falls right through the cracks. It is important that Ghana at this stage, that, once any issue that occurs in the MMDAs, it should really be a huge assembly issue. I know that we haven't gotten there yet, but I'm saying that this is one of the reasons why those of us who have called for complete decentralization, it should happen, just so that, the authority is not many miles away from where the seat of action is.
Yeah, Prof, you see, when I say it is under the purview of the agric people, I don't mean they are separated from us. No, we have the agric department under the AMA.
We'll take a break, and when we come back, we will continue the issue. With me in the studio discussing how we can break the annual cholera cycle is Dr. Linda Van Otu, who is the Regional Director of Health Services in Greater Accra, and Dr. Simpson Boateng, who is the Public Health Physician with the Accra Metropolitan Authority. Just before we went on break, we were talking about food. We've spoken about food vending, but we're talking about cultivation and the water that is used, to grow vegetables. And as health operatives, we are touting that people should eat a lot of vegetables, knowing very well, sadly, that our vegetables are watered with, water containing all sorts of things. What do we do?
I think first and foremost, we need to engage the urban farmers. You see, because most of them may be doing that out of ignorance. So we need to engage them, we invite them, and then we educate them. We tell them about the consequences of their trade, the larger population. So that is very key. You have to do that.
They're going to tell you that they've been doing this for years.
Then again, we also need to, provide them with, other source of water, good water. And that I think they can do. Because if you are cultivating for money, then you should be able to, get money to, run your business. So I think we have to let them know that they have to be responsible and provide clean water. They can come together, a group of them can come together, dig a well,
If there's a cheap source of water nearby, and they've been doing it for years, and all of a sudden they are going to incur extra cost?
No, I think we have to apply the whip. We have to make sure, we have to, force them to do the right thing.
So it's a law enforcement issue.
There is.
And
yes,
I think
it's a law enforcement issue, and I think may have to. Maybe we have, but we will have to revisit it and then make sure that the right thing is done.
Now let's just look at the issues that we've spoken so far. I want us to be able to tell the people of Ghana that 2015 we will not have cholera. Is it a statement that we can say today?
I think I can confidently agree with you that we can safely say that. And why do I say that? Now, we know we have already accepted that, you can get it from, a clean, you cannot get cholera when your environment is clean. You get it from a dirty environment. Now, what the AMA is doing now to ensure that we don't have a similar situation next year is what I'm going to tell you. Waste management. We are talking of liquid waste management. Now, Lavender Hill, I think we haven't mentioned Lavender Hill. Lavender Hill has been with us for a long time, and all the feces in the city end up there, untreated. Fortunately, AMA is going to treat all the, the fecal matter. In fact, we have acquired some digesters, some at, the Lavender Hill area, the fire service training school. Yes, we have acquired some digesters there. Then behind it, there is the Mudo plant. The Mudo plant, which has been non-functional for a very long time, is being rehabilitated. The engineers have come from abroad and they are working on it day and night. We have also bought some digesters at Legon, which is taking care of the northern section of the city. You see, so with this in place, I'm sure everything is going to be okay now. Now, that is liquid waste. We are also constantly ensuring that people have toilets in their homes. That one, we are not compromising on that at all. We are also encouraging the central sewer system so that it wouldn't be necessary for anybody to now dig a septic tank. We are laying pipes, and the engineering work is ongoing, and very soon everything will come to an end. But that is for liquid waste. Now let's talk about solid waste. Solid waste, the problem has always been a final disposal site. Before we were dumping around Malam, Wager area, on this old quarry sites, and we managed to fill all of them. In fact, we were doing what we call crude dumping. And when they were all filled up, we had to travel to Pong, which is beyond Tema. And that's how come recently we had that unfortunate incident. Now we have acquired 2 landfill sites, one at Insomnia and then the other one at Sonetra, which is around Wager. In addition to that, we are constructing what we call transfer stations, and we are constructing 4 of them. Transfer stations waste in a day. It's a huge amount. So during the daytime, we transfer all this waste into those transfer stations, and at night we slowly cut them to the final disposal site.
But at those transfer sites, you could start, recycling.
No, I haven't landed, Prof. We have also acquired 1,000-acre land, you know, and we are going to construct an engineered landfill site with a waste-to-energy program attached to it. We are going to do a recycling. We have thought of all these things, and all we are waiting for is to get the funds to start.
2015 is not
far away.
Far away.
But at least we have gotten the landfill sites, and we have started even using them. So there wouldn't be any time that we use 2015, but even now you don't see the heap of refuse that used to be in town. They've all disappeared. It's because of the arrangements we've put in place.
Okay. Linda, I don't think you would venture and say that 2015, no cholera.
Oh, it is possible.
Okay.
But we are also putting in measures so that we don't have what we are seeing now. And we are calling it the clean community and the environment, clean environment and communities initiative. We think that the education should be sustained, and we should start from as low as we can from the children. And we're going to do that. Mount a campaign against cholera, against the poor environmental sanitation and the poor practices that we see around. And it's going to be ongoing. We are looking at engaging stakeholders. These are in the short term, so the education will be ongoing. In the medium term, we hope that we'll be able to get people to look at, for example, the farmers that he was talking about. I think there are people who have been trained to support such people with simple things that they could do in terms of storing water. The rain falls, just rushes out, and it causes havoc for us. But people could have stored the rain and used for other things. So I believe that we have stakeholders who can support these farmers to be able to do this. We're also going to continue with our public education about the food and the water, those who prepare it and those who buy. And we want the assemblies to support us so that these stickers that we are talking about, or what they will hang around their necks, will be something that everybody can see. And if you are stationary and you are selling food, we want you to know that you can have a coal pot, or they have these clean cook stoves that we have. People can have them and then heat the food as we go along. So we want people to understand all this. And then as the health sector, we are going to improve on the areas that we receive the cases. We pray that it doesn't go to this extent, but we are going to train our staff to be able to manage the cases when they come, for us to reduce the deaths. Even if we have only 100, we pray that nobody should die. And as we do this, it will be a long-term thing. The long-term thing that I believe we need to do is with what has been discussed. How do we ensure that people do not flout the laws and go scot-free? I think it's very, very, very important. Every school must also be provided with toilet. That one can be from the medium term to the long term. And I think that it should be part of the measure for the assemblies, that the district assemblies, as at now, should know how many schools they have in their districts, how many of them have toilets, how many of them have water, how many of them have places that they can dump the refuse. And they should be given quotas or targets that between now and 2015, if you have 10 schools, make sure that 3 of them have this. By the end of 2015, all schools should have it. And if we have water, we have the toilets and all that, then we can teach these young people and the teachers as well. And I think that the law must be enforced, that people who defecate along the gutters must also be brought to book.
Listeners, we've been discussing how to break this annual cholera cycle. We have clearly indicated that you get cholera from eating or drinking an infected person's feces. That is not a very exciting statement to say that 12,124 Ghanaians have eaten infected feces or drunk infected water. We've talked about personal hygiene. Why should anybody go to toilet and not use soap and water to wash their hands? And why should anybody touch food without using soap and water to wash your hands? even chewing granuts, even buying, snacks along the way, it should be important for you to stop and say, I haven't washed my hand and therefore I cannot put anything in my mouth. Viewers, you've been listening to Professor Akosa's take on breaking the annual cholera cycle. I've had in the studio to discuss this issue Dr. Linda Vanotu, the Regional Director of Health Services in Greater Accra Region, and Dr. Simpson Boateng, Public Health Physician of Accra Metropolitan Authority. Thank you for watching. I hope you have been educated. Thank you.